Hello, it's Dr. Jeffrey DeSarbo again. I'm up to NeuroSeries episode 12 with everybody. Hopefully, this isn't the first one you've jumped to. This one here can get sometimes a little more complicated. It's because we're talking about a lot of the medical aspects, but it's based on a talk that I actually developed with Dr. Joel Jarrus from Florida on when we were having a conversation one day about he does a lot of the medical aspects, and my interest being in the neuroscience and neurobiology, we were talking about how the organ systems in the brain influence each other. So we noticed this interesting thing as we were talking. It's like, well, if somebody is having certain issues with one of the body's functions, with an eating disorder, with anorexia, with bulimia nervosa, binge eating disorder, the things that can be taking place in the body then has this feedback to the brain, and it can make the brain start to think and function, work differently, and vice versa as well. There seems to be, this correlation as we've been talking about all these different types of changes that can take place in the brain and central nervous system. Those changes then send signals to the other parts of the body that can significantly influence how they're functioning. So when we look at the different types of systems in the body, gastrointestinal, cardiovascular, endocrine, immune, musculoskeletal system, all these systems, there's this connection both between the brain and the organ systems as well. So when you're working with an eating disorder, it's really important that the medical doctor fully understands what's going on with the patient. A lot of patients often don't want to share the details of their eating disorder behaviors and try to keep it hidden. But it's important that the doctor become aware of kind of what's been going on with your eating disorder. I know a lot of the difficulty is patients often feel their doctors don't understand eating disorders. And again, that's why it's best to always make sure you're trying to find a doctor who does understand eating disorders. And then they work together with the psychiatrist and the therapist. But all these systems can have an effect. And this talk that we worked on was probably a good 3-hour talk, which covered some simple basic things. So I'm just going to go through just kind of giving you a representation of how the brain and the body interact with each other. Of course, when I talk about the central nervous system, and there's also a part of our nervous system called the peripheral nervous system, which as all the wiring, it kind of goes out and handles signals that come from our muscles, from our intestines, from our lungs, from our pancreas, from the spleen. And there's this signal feedback that goes up to the brain. The brain senses what's going on, sends feedback back down. And so while I mostly end up showing you a lot of the factors and changes that take place with the brain with an eating disorder, the other parts of the nervous system also can become significantly challenged, including the peripheral nervous system, and people can start developing what's called neuropathies, like shooting pains in limbs. Pain tolerance, however, for some things like with anorexia nervosa is actually higher. So sometimes people can get some serious injuries and they don't sense the pain as well because the neurofiring going back through the peripheral nervous system isn't kind of working as well. Now, when we move on to the gastrointestinal system, I may have mentioned this before, but it's highly loaded with neurotransmitters, including dopamine and serotonin and acetylcholine. These are neuroreceptors that we're thinking about are in the brain and central nervous system, but there's actually more serotonin and dopamine neurons in the gastrointestinal system than there are in the brain. So there's a lot of signaling that's going on that not only controls kind of the functioning of the gastrointestinal system, but it sends signals back up to the brain, like hormonal secretions and everything that this back and forth conversation saying, I think I'm hungry, I think I ate too much, I'm feeling nauseous right now. And so the brain and the gastrointestinal system, when either one of those is kind of becomes more dysfunctional with an eating disorder, it affects the other. So, in our talks, we'll go through some of the different types of gastrointestinal disorders and symptoms people with eating disorders get. You get that thing with if anybody starts engaging in behaviors such as purging through vomiting, self-induced, you kind of get motility disorders. It kind of paralyzes, and in fact, it's called gastroparesis. It paralyzes the movement of food through the gastrointestinal system, and people end up things like severe cramping, feeling bloated, having constipation. And there's a lot of potential medical complications as well, like when people might engage again in that vomiting or purging, kind of creating, changing the cellular makeup of the walls of the esophagus and kind of leading to like precancerous types of disorders and conditions. So, the GI system has something that has to closely be monitored. And like I said, if people are often with eating disorders going to a gastroenterologist, but failing to report what they're actually doing with regards to their eating disorders. And they really do have to let the doctors know what's going on. As I mentioned in a prior slide as well, we've got the vagus nerve that goes down from the brain and innervates things such as your heart. So it controls its contractility. It can lead to palpitations, the heart racing, and that comes from the vagus nerve, which originates in the brain. There's a multitude of studies of the cardiovascular effects that go with eating disorders as well. And I may have mentioned one of the biggest mortality, the risk of dying from an eating disorder, is related to cardiac function. And there's several reasons why that can take place, such as refeeding, the heart just becomes weak. People think, well, if I lose weight, I'm losing body fat, which isn't the case. You start to lose muscle tissue, and the heart is a muscle, so the heart can become very weak. People's EKGs changes start to take place. The rhythm that's supposed to be there is thrown off. They don't respond to certain types of peptides and hormones that they're supposed to. Heart rate can drop into, low 40s, low 30s, low 20s. And of course, people want to say, well, I'm an athlete, but it's not the same. It shouldn't be down into the 30s and into the 20s where people need actually admission to a hospital. And when you're getting this low heart rate and the heart's not pumping as fast, it's not sending blood to the rest of the body as well, including to the brain, okay? So the brain gets a decreased blood flow, kind of like making somebody become more fatigued all the time. They can't think as clearly. They're more likely to make errors in both like calculations, but in errors in judgment as well. And it changes the function of the brain, how it processes the eating disorder. Hormones have a tremendous fallout from an eating disorder. A lot of the hormones for sexual reproduction, the hormones for a regular menses in a female, the thyroid gets affected. Thyroid functions maintain our energy levels as well, and the functioning of the metabolism in our bodies. Our skin which has multiple functions, including its own self-protective reaction to outside infections and everything. Hair, people start to lose hair because it's not getting the vitamins, the nutrients, the minerals that it needs. So there's a lot going on with hormones in the body, and this is part of the endocrine system. Now, there is this other thing, and people don't understand at times, it's referred to as the forgotten endocrine organ, which is adipose tissue, which is fat tissue, And you can see that the tissue itself is responsible for producing so many of these different substances that the body needs, okay? I won't go into all of them, but during our talks, we talk about the different adipokines and the different lipokines that the adipose tissue kind of is responsible for producing. And if you want to hit pause and read on some of these, what you'll always see is that it's these types of adipokines and lipokines are responsible for survival of the hippocampal region, making neurons connect to each other so that they don't kind of like fall apart. there's a lot of everything that you see here has something to do with the central nervous system and the brain's neurocellular functioning, okay? With reproduction, that's a very tricky and complex issue. Women with this slide in particular was around anorexia. The women were twice as likely to need to undergo fertility treatment who've had anorexia nervosa or bulimia nervosa. Also, for some reason, there was no explanation. They said about 2 to 3 times more likely to have twin births. A lot of people, though, think, well, if I'm anorexic and my menses isn't regular, or if I'm not even getting it, then I can't get pregnant. Because of that thinking, rates of unplanned pregnancies are actually double that is for people without an eating disorder. They think they can't get pregnant, but then they end up getting pregnant. And because of that, too, there seems to be an increased risk of induced terminations. So if somebody says, I'm worried about having anorexia, yes, there's some sign to say it could potentially jeopardize your future reproductive capability. Many times it doesn't, and especially with recovery. And if you work on things, most people end up being able to have children. So it's a tricky subject, but we talk about that a lot when it comes to, well, how does an eating disorder kind of affect that ability? Obviously, there's a lot of psychological fallout with that, both while somebody's experiencing an eating disorder and all their concerns they have. Will I be able to get pregnant later in life? Or, if they are pregnant, how is that affecting my fetus? And then that psychological fallout goes to the brain, and the brain starts trying to handle it and undergoes its own stress modifications. So, again, back and forth with each of these. There's a lot of different types of immunosuppression that they find with anorexia nervosa. However, the whole topic of immunodeficiencies is very complex. And recently, as this presentation was being made initially during the middle of the COVID-19 outbreak, there was a lot of questions around how are patients with eating disorders going to fare through this. On one of the other videos in my slide collection, my video collection, there is one titled Anorexia Nervosa and COVID-19. So if anyone wants to actually look at that, you get some more information on the infection with COVID-19 and how that relates to somebody with anorexia nervosa. That was actually made early on during COVID. Now, what the studies were kind of looking at is prior to this, that some studies said, okay, it looks like people who have anorexia nervosa may be more resistant to infections. And then there were a few studies that said, no, it looks like they might be more prone. But when you looked at the studies that are kind of out there and across the board, it kind of looked like there was not an increased risk of infection, that they said basically they're about the same. Now, certainly through COVID-19 at this point, over a year later, I have more patients than I can count that have had and acquired COVID-19 infections. Some of them, did fairly well through it, relatively asymptomatic. Many of them have more of that long-term sequelae, that they're having weird reactions months and months later, still from the COVID-19, which is what's also found in people without eating disorders. But so again, risks of it have been about the same. I don't have, but I have a colleague who has had one patient actually pass away from COVID-19 who had severe anorexia nervosa. So it certainly isn't that anybody is kind of immune from infections. But they do sometimes show symptoms differently. They found out early on that people with anorexia nervosa did not seem to mount a fever response. And one of the first things when COVID-19 hit was, let's check everyone's temperature and let's look for something at 102 and above. That was not a symptom that you would see in people with anorexia nervosa. So the presentations, and I talk more about that in my other talk on anorexia nervosa and COVID-19, which you should be able to find in the same group of slide subsets as these. There is renal involvement that leads to a lot of, your kidneys are kind of functioning, playing a main role in kind of your chemistry's balance. So, getting things like low potassium levels, sometimes high potassium levels, getting kidney stones, passing blood through the kidney. Those are things that you often see with eating disorders. And then it changes actually the makeup of some of the things like growth factors, and those adipokines and things that I've mentioned before get altered. And when you start changing some of these things, it filters back up through the peripheral nervous system and talks to the brain, and you start getting reactions and changes from the brain as well. So always this study here comes to, renal function, bedwetting and incontinence, and especially with people who are adolescents, that you can have nighttime enuresis at rates as high as 17%. And an adolescent is so embarrassed by this. They don't even maybe understand what's going on when they have an eating disorder. And it's important that their physicians and even their therapists and their nutrition sometimes screen for this, because if somebody has 100 patients, there's 17 of them may probably have nocturnal enuresis. Now, this study here was in adolescents, but I've seen that in people who are also older, in their 20s, okay? So, and I'm sure it could be in all ages, but this study here that I kind of put out here had it, the bedwetting and urinating at night, that was kind of ceased. It stopped after they were weight restored with anorexia. So, but these are the types of medical and psychological factors, how they combine with each other to create a more distressing experience when someone is dealing with and going through an eating disorder. Some pulmonary functions do change. Again, that you have a lot of respiratory muscles. They can be weakened with people with eating disorders and anorexia. So kind of getting enough oxygen into your lungs, into your blood system is another way to kind of decrease the brain's functioning, thinking clearly, being fatigued. And there's even a case study of early emphysema in patients with anorexia nervosa. There is changes, of course, to muscles because of and it's not just with anorexia, but it can be with bulimia nervosa as well, because of a lot of deficiencies that take place, especially micronutrient deficiencies. And then you get changes to your bones, a lot of osteopenia, osteoporosis, and these lead to oftentimes many fractures and a much more, not just stress fractures with the bones, but a stressful life. And that's what some of these studies talk about here. So it is key, especially in any form of a malnutritioned individual with an eating disorder, that you can have significant changes in the musculoskeletal system. A lot of times people, especially if you have an eating disorder in a child, adolescent, teenager, you want to get something called a DEXA scan. It kind of looks at the bones and everything, see where the growth plates are, because if people get fractures in the growth plates when they're young, secondary to an eating disorder, there can be certain developmental issues that come with it, as far as how somebody walks and runs, and different types of neurological pains as well. Of course, not everybody who has or appears to have like an eating disorder necessarily is caused by anorexia nervosa or bulimia nervosa. Again, using the term anorexia as a medical term for somebody who's significantly underweight, malnourished, whereas anorexia nervosa is the eating disorder. But I just use this because it was just something I never even heard of. But a differential diagnosis is, why else is somebody kind of having these types of eating patterns, behavioral patterns, or significant weight loss? This is called mitochondrial nasogastrointestinal myopathy, which in this case, somebody thought, well, looks like this person has anorexia nervosa, and it's actually due to a genetic condition that was causing this. And so I kind of, again, just put that up there to kind of say, a full medical analysis assessment needs to be taken place by somebody who truly does understand eating disorders. Because the one thing is, when people have a diagnosis like this, and you ask that question, I say is so key to understand the quantity and quality of one's thoughts. How much of your free thoughts do you spend thinking about food, weight, body image, calories, exercise? And the individual says, I don't know, none, 5%, 10%, that's not the eating disorder, okay? So sometimes, it can be caused by another different type of diagnosis when something looks like an eating disorder. So reviewing, you can get changes in any of these systems, but basically any change in a body's function and a body's system can create changes in the brain and the central nervous system. And that feedback goes in the other direction. When you have any change to the brain and the central nervous system, it can affect your other body systems. So that's kind of like a very simplified version of the brain-body connection, which is a little different from when you might hear just typical medical talks or discussions or books that say, well, when you have these eating disorders, here's your medical risks. You kind of don't realize is, well, when there's any changes to these types of things that are going on with the body, it's going to significantly affect the psychology and the brain functioning as well. So just want everyone to kind of take that home from this brief talk here. The next will continue on some of the neurobiology of nutrition. Again, a little bit different talk than just, what you often may hear or read of how to handle nutrition, what it's about with an eating disorder. So I welcome everybody to please continue on to NeuroSeries episode 13 for that.